Good morning, everyone. Welcome to this Powered by DrugBank academic webinar. My name is Chris. I'm currently a software developer at DrugBank. And so this morning, what we have is Dr. Draško Tomić, and I will let him introduce himself in just a minute here. He has graciously recorded a presentation that we will watch, and then it will be followed by a live Q&A session. Of course, if you like this webinar, I'd like to encourage you to follow us on various social media like LinkedIn, and to check out our webpage for more information and to stay up to date with future events such as these. So without further ado, I'd like to introduce Dr. Draško. Yes, would you like to say a few words about yourself?
Hi, hello to everyone. I'm a researcher at Ruđer Bošković Institute, and during the development of Vinnie, I realized that my goal is aligned with that of DrugBank. That means to help develop maybe better drugs than we have now. And this is the reason the main reason, not the only one, but the main reason that I participate in today's DrugBank academic research webinar, and thanks to DrugBank, Kathleen, and everyone for inviting me. Okay, that's from my side.
Perfect, thank you. All right, so we will now watch the video, and remember to pop any questions you might have into the Q&A chat. So we'll be doing the live session.
Hi there. My name is Draško, and I'm a researcher at Ruđer Bošković Institute. Development of applications that might contribute to the creation of improved cancer drugs is the main goal of my research. Formerly, I was chief technologist at Hewlett-Packard Company and responsible for implementing and scaling NAMD and ANSYS on HP Heavy on public cloud. I did my postdoc research at Rijeka University, teaching students, administering Bura supercomputer, and developing Vinnie in silico model of cancer. My main awards are recognition by HP for significant innovation in the field of HPC cloud systems, membership in the Hewlett-Packard Hall of Fame. During the development of Vinnie, I realized my goal was aligned with that of DrugBank to help develop better drugs. This is the reason for my participation in today's DrugBank academic research webinar. Let's talk about Vinnie in silico model of cancer. Vinnie is a high-performance computing application that performs virtual drug screening for various diseases. There are many structure-based virtual drug screening programs. Some of them are commercial, while others are open-source applications. They all boast about being the top in their class. However, what makes Vinnie outstanding is the use of pathways that describe diseases. In silico modeling of cancer involves combining findings from biological literature with computer-based models of biological systems, and that in order to conduct investigation of hypotheses entirely in the computer laboratory. The pathways of cancer diseases are graphs presenting biological processes in cancer. Vinnie uses cancer pathways which are entirely built on the experimental facts found in the literature. Vinnie can also evaluate these hypotheses with the results obtained by experimental methods. Thus, it all makes the Vinnie in silico model of cancer an outstanding platform for the study of processes that contribute to the onset and development of cancer. What's the biological precedence for using pathway-based virtual drug screening? First, many virtual drug screening methods have been developed for identifying single-target inhibitors based on the strategy one target, one drug. Hit rates of these methods are often low because they cannot capture features that play key roles in the biological functions of the target protein. Furthermore, single-target inhibitors are often susceptible to drug resistance and are ineffective for complex diseases such as cancer is. Multi-target, multi-drug strategies can reduce the possibility of developing drug resistance. However, they ignore the effects of drugs on other, that means non-target proteins, which can then lead to worsening instead of improving the course of the disease. Therefore, it is necessary to take into account all receptors, that means proteins and substances and genes playing a role in the onset and development of diseases. But then, it is extremely important to know how these receptors interact with each other. Only pathways can provide this information. Because of that, Vinnie uses a pathway-based multi-drug strategy for virtual drug screening. Drug repurposing is the process of uncovering new indications of approved or failed abandoned chemical compounds for use in a different disease. Drug discovery is the process of identifying chemical compounds that have the potential to become therapeutic agents. Vinnie is able to perform both drug repurposing and drug discovery. For drug repurposing, Vinnie uses drug structures from DrugBank. For drug discovery, it relies on the PubChem database. Why we use DrugBank? Because it is the largest database of drug structures that we are aware of, besides as academic users. And for this Vinnie development, we have successfully applied for free access to DrugBank resources. Let's take a look under the hood of Vinnie. Vinnie collects KEGG pathways from KEGG databank, drug and compound structures from DrugBank and PubChem, genomic and transcriptomic data from Cosmic database, Protein databank, and UniProt. Then it constructs data flow matrices, performs data flow optimization, and predicts drug candidates. This is a little more complex data flow schema. As you can see, there are pretty lot of program modules in Vinnie, and we will not go deep in this data flow, but only to mention that Vinnie has application interfaces to databases like UniProt, Cosmic, KEGG, etc., and also works with a program like Autodoc, Vina, like AlphaFold, and of course at the end, if it computes SLAM. Where to use and where not to use Vinnie. It is a structure-based virtual drug screening tool working on metabolic pathways of diseases. Therefore, it can be used for virtual drug screening. As it is also in silico model of cancer, it can be used for computer-based analysis of the main hallmarks of cancer and as a testbed for various cancer-related hypotheses. However, as it doesn't take into account unwanted side effects of drugs, their pharmacokinetics, for example, and pharmacodynamics, Vinnie is not a tool for predicting either drug efficacy nor drug efficiency. What are the basic premises of Vinnie? First, drug or chemical compound producing the low data flow speed in data flow graphs is likely a good candidate to initiate the slowdown of cancer disease or even stop it. Then, if a drug is a good candidate, then it deserves further in vitro and in vivo analysis. And if a chemical compound is a good candidate, then toxicity analysis must follow. Pathways. They are graphs that describe metabolic processes within organisms. Graph nodes represent the names of receptors, which could be either genes, proteins, or substances. Edges represent interactions between receptors. Some pathways are based on published experimental evidence, while others are computationally generated. Vinnie uses KEGG pathways based on published experimental evidence. There are thousands of KEGG pathways available. Vinnie is able to use all of them. Many of these pathways describe metabolic processes in human disease, including cancer. Here we can see some main hallmarks of cancer. For example, sustaining proliferative signaling, second evading growth subpressures, activating invasion and metastasis, enabling replicative immortality, inducing angiogenesis, and resisting cell death. But it is to point out that any cancer pathway must necessarily describe at least 6 basic mechanisms of cancers. Here we can see an example of one KEGG cancer pathway. This is a general cancer pathway. And the graph nodes are here in green, then hallmarks of cancer in gray, arcs connecting receptors. And what we need to go a little deeper in are eigenvalues, Markov chains, mixing rates of Markov chains, and data flow graphs. to understand how Vinnie actually works. Eigenvalues are a special set of scalar values, and they are associated with a set of linear equations, most probably found in matrix equations. Eigenvalues of matrix A are scalars satisfying equation 1, which expanded leads to the characteristic polynomial in next equation numbered 2. The roots of this polynomial are eigenvalues, and we note them here, lambda. Mixing rates of Markov chains. Markov chain is a stochastic model describing the sequence of possible events in which the probability of each event depends only on the state attained in the previous event. Its transition matrix, T, describes the probabilities of particular transitions. In case of symmetric random walk, the rate of convergence to equilibrium, that means the mixing rate of the Markov chain, is determined by the second largest eigenvalue modulus of T, abbreviated SLAM. We can see here an example of small Markov chain, its transition matrix T, and the eigenvalues of this matrix are lambda 1 and lambda 2. Because the lambda 2 is the second largest eigenvalue modulus, has a second largest eigenvalues modulus, the mixing rate of this Markov chain is 0.1. Fastest mixing Markov chains. The problem here is to find the edge transition probabilities that give fastest mixing Markov chains. That means that minimize SLAM. This problem can be formulated as a convex optimization problem, which can in turn be expressed as a semi-definite program. That means to minimize SLAM subject to P higher than 0, P1, here 1 is unary matrix is 1, and P equals transpose of P. For the analysis of a data flow graph, one has to transform it to the corresponding Markov chain, then to use this algorithm, that means to perform semi-definite programming, and then revert back to the optimized Markov chain, that means to the data flow graph. Also, we have a slowest mixing Markov chains, and here the problem is opposite to the fastest mixing Markov chain. That means to find the edge transition probabilities that give slowest mixing Markov chains, that means that maximize the SLAM. As the algorithm for finding slowest mixing Markov chains is not known yet, this problem cannot be solved with semi-definite programming. However, it can be solved by examining all possible chains and finding one with the highest SLAM. That means with the slowest mixing speed. As Vinnie is analyzing metabolic processes, which are deterministic in their nature, Markov chain must be replaced with data flow graphs. All nodes and edges of data flow graphs must have, of course, some numeric value. Numeric values in Vinnie's data flow graphs represent energy values. For nodes, these are free binding energies between receptors and ligands. For edges, these are interactions among receptors. Here, the data flow presentation of Vinnie's search for better drug. Starting with the first drug, Vinnie gets somatic expressions and mutations from cosmic database, then drug and receptor structures from protein data bank and from DrugBank, cancer pathway from KEGG, and then it constructs data flow graph and data flow matrix 1 and computes SLAM 1. The process is repeated for the second and for all drugs or chemical compounds under the investigation. At the end, Vinnie produces a list of SLAM values, sorts them in an ascended order, and the drug or chemical compound with the highest SLAM will point to the probably good candidate, and with the lowest to the not so good, say we, drug or compound candidate. So let's take a small walk from the pathway to SLAM. In the first step, pathway receptors are replaced with their structures. That means with their three-dimensional structures taken from protein data bank. Or in case these structures doesn't exist in protein data bank, Vinnie uses tools for predicting their structures. In step 2, ligand, which can be either an approved drug or chemical compound under investigation, is docked on receptors and free binding energies are computed. Data flow graph is created with nodes representing free binding energies and edges representing interactions between receptors. In last step, graph is presented with a matrix and its SLAM computed. Now we really need a little break from SLAM, Markov chains, mixing rate, data flow graphs, etc. Here we can see schematic presentation of Facebook friends, and approximately Facebook user has about more than 200 Facebook friends. But the number of real friends is considerably smaller. In my case, I have only few friends, and among them are Velika and Mala Vinnie, produced big and small Vinnie, and that is the reason why I named this in silico model of cancer Vinnie. Let's take a short look at Vinnie components. First, their application interfaces to external databases and portals. Of course, one very important database is DrugBank, and Vinnie acquires drug structures from DrugBank. Then KEGG, from which Vinnie acquires pathways of diseases. Then UniProt. UniProt is contacted in case no structure, that means three-dimensional structure, is available. Then Vinnie contacts UniProt database, acquires from it FASTA sequence of protein, and converts FASTA to 3D structure with special tools, programs that we will see next. Then also one of the most important components is protein data bank with its more than 100,000 protein structures. And because the KEGG pathways, the most components are genes and proteins, then Vinnie frequently contacts protein data bank for these structures. From Cosmic, Vinnie acquires genetic expressions and mutations for various types of cancer. And it uses a Swiss Institute of Bioinformatics portal when it needs to predict some protein structure. And then PubChem. PubChem, in case a ligand that means a compound under investigation is not an approved drug, then it acquires its structure from a PubChem database with hundreds of millions of chemical compounds. Take a look at third-party programs. Of course, the most important in Vinnie. This is Autodoc Vina, which performs docking and free binding energy computing between proteins and small molecules. MGL tools, which are used for preparing receptors and ligands. And both these tools are from Scripps Institute. Then Rosetta Doc and Rosetta Antibody. Vinnie uses to dock, to perform docking between two proteins and to predict structure of monoclonal antibody drugs. UCF's Chimera is used for preparing finally protein structures. OpenBubble to convert chemical files from one format to another, and AlphaFold to predict receptor protein structures. Then also Reduce, a famous program from Duke University, which Vinnie uses to add hydrogens to proteins. Let's take a small look at use cases. First, what is the accuracy of the Vinnie model against the clinical trials? We validated that. So we let Vinnie to process 70 cake cancer pathways against 132 cancer drugs. Evaluation of the results was performed by taking for each cancer pathway 5 drugs with the highest SLAM values and then examining their efficiency from the available in vivo studies. In the right table, you can see hits, that means drug is drug efficient, are labeled in green. Misses, that means drug is not efficient, in violet. And yellow means studies exist, but results for some reasons are not available. White field means in vivo study was not performed for that cancer type and drug. The probability that Vinnie will correctly predict the efficiency of a drug against a specific type of cancer is defined as the ratio of the number of green fields to the sum of green and violet fields and is 0.793. Next use case, the accuracy of Vinnie in predicting the efficacy of cancer drug combinations. We let Vinnie calculate the most effective 2-drug therapies against non-small cell lung cancer, small cell lung cancer, and pancreatic cancer. Vinnie calculated the combination of vinorelbine with paclitaxel as the most effective against non-small cell lung cancer, then the combination of everolimus with doxorubicin as the most effective against small cell lung cancer, and the combination of everolimus with paclitaxel as the most effective against pancreatic cancer. The results from existing clinical studies strongly confirm the results Vinnie predicted. The next use case is the accuracy of Vinnie validated against NCI 60 GI50 data. So Vinnie computed SLAM for 50 FDA-approved cancer drugs and then over 30 NCI 60 cell cancer lines. Then it correlated computed SLAM values with GI50 data for these lines. Pearson correlation values have shown good values ranging from 0.40 up to 0.64. Also to mention, GI50 is the concentration that results in inhibiting cell growth by 50%, And this is an example of negative Pearson correlation, where two sets correlate inversely with each other. The higher SLAM is, the lower the concentration of drug is needed. And then the case 4, we deployed Vinnie against COVID virus. Vinnie was applied at the very beginning of the outbreak of COVID pandemic to find the most promising triple combination of existing antiviral drugs against this virus. Structures of 50 FDA-approved antiviral drugs were downloaded from DrugBank and used in this experiment. The combination of HIV drugs ripivirine, coxistat, and abacavir was identified as the most promising candidate for blocking spike glycoprotein activity. Vinnie is the next generation supercomputing application. It was powered on the Mare Nostrum supercomputer in Barcelona to enable the creation of an advanced protein-protein artificial intelligent docking model based on neural networks. Currently, Vinnie is under further development on 3 other supercomputing facilities: Vega in Slovenia, Bura at Rijeka University, and Isabella Supercluster at Zagreb University. Also, we need to note that Vinnie is an open source application. However, third-party programs and databases are licenses, and they are for free for academic use. So if you find Vinnie Silicon model interesting, then you are more than welcome to join our efforts. What is the future of Vinnie research? Towards the integration of NAM-driven coarse-grained molecular dynamic protocols. And because now Vinnie is working on all atom scale, and simulated time periods are in the range of nanoseconds. When we move to the coarse-grained molecular dynamic, then we will be able to hit more cancer phenomena than just now, because then we will be able to work in milliseconds range. Here you can see some of Vinnie friends, and these are researchers that take a look at Vinnie, published some papers related to Vinnie, were involved in the preparation of project proposals, provide some good or even brilliant ideas for the further development of Vinnie. And I hope this number of friends will grow to the more than it is now. So I would like to thank you for attending, and now you are free to ask the questions.
Okay, that was a fantastic presentation. Thank you. So, as Dr. Tomić said at the end there, we're now into the Q&A session. So please feel free to pop questions you have into the chat bar, and I'll be going through and reading them out. Okay, so it looks like we have a question here about the details and problems about high-performance computing infrastructure on which Vinnie runs. If you'd like to speak to that.
Please, can you repeat the question?
It's a question about any details or problems about the high-performance computing infrastructure on which Vinnie runs.
Actually, these all HPC clusters that Vinnie runs have a stable infrastructure. However, there are, of course, clusters that Vinnie is not able to find some programs, or even these are clusters that do not allow the connect inbound, outbound connections and acquirement of data from these databases. In that cases, before starting Vinnie, installation procedure must be started, and it unfortunately it lasts for about 2 or even 3 hours. It depends whether some programs are available on this cluster infrastructure or not. But after that, after all programs are in place, Vinnie starts to work. And we didn't actually experience the problems with these clusters. As I said, the only these are not the problems, but challenges is when you land on the cluster that has not program model available. Then as I said, Vinnie must contact software provider. It goes automatically, downloads these programs and incorporates these programs in the program code. Of course, most of these programs that Vinnie uses are free for academic use, but they are licenses. So you have to approve that you are from academy, and so you must be able to approve this via your domain, via your email address or so. If you are a commercial user, then something should be paid for the program, for the database, etc. And in all these cases, we don't have any problems with the free licenses from DrugBank. Just now, I want one time more to thank the DrugBank, to KEG, to all other database providers, and of course to the providers of programs like Rosetta and like scripts, tools, etc. But anyway, it could be the problem that a certain HPC cluster is under the heavy load. Then, as Vinnie is distributing tasks, jobs within the cluster, then when it is under the heavy load, then probably you will wait. That waiting times can be in the range of several seconds to even in some very strange cases to several hours, but the programs then are executed and results from compute nodes collected, and as hopefully Good describes in these former presentations, then data flow graphs and matrix are built, SLAM computed, and this is so. Sometimes of course, it can happen that some cluster resources failed for some reasons, and this is very rare situation which we experienced one time in 5-6 years of the Vinnie development, and just now Vinnie doesn't have any mechanism to recover, so you need to start it again. So these are main problems that we experienced with the HPC cluster. I hope it answers your question.
Yeah, for sure. And of course, academic licensing is always an important consideration. So we have a question here. I believe I saw a slide that spoke about pharmacology applications. So to confirm, are you saying that Vinnie cannot be used in these sorts of scenarios?
Sorry, what scenarios?
Something to do with pharmacology.
Okay. Actually, Vinnie is working on the intracellular level, and is working with the molecular structures of genes, eventually their encoded proteins, and also in these pathways, not only in the cake pathways, but for example in reactome and other pathways. There are some small structures, compounds, chemical compounds, small molecules that have an important role in the onset and the development of diseases described with these pathways. And Vinnie is not, as already pointed out, tool made to find out the efficiency of the drug, because, for example, it doesn't takes into account the extracellular matrix of the cancer and drug diffusion in the body and all these other important parameters that can make one drug effective and another drug not effective. So it only works on this intracellular level. And this is, for example, one reason why Vinnie, and not only Vinnie, but any other virtual drug screening tool like Vinnie or in silico model or cancer will never hit 100% accuracy that we acquire with in vitro experiments or with clinical trials, etc. This is about the pharmacology, and of course one can play and also try to bring these functionalities, additional functionalities, maybe also the toxicity exploring in his or her model, but this will be then I would say tool for everything, and tool for everything, in my opinion, is would be a not so good tool, because tool has to be specialized. And another problem is that all in silico models of cancers work in their time and space line. That means one works like Vinnie works in the on the intracellular level, molecular level. Another in silico models of cancer are trying to explore the extracellular matrix or other phenomena in cancer, and they are working on the different scales. That means out of the cell, even within the whole body, and they are trying to test some hypotheses then with the other tool, like the differential equations and such pretty mathematical tools like this. Yes. So this is in very short about pharmacodynamics and eventual trials to incorporate this. This is not our plan with Vinnie.
Mm-hmm. Yeah, there's always going to be issues surrounding in silico modeling, but I believe you make an excellent point about focused tools for focused questions and not overreaching the scope of these sorts of analyses. So here's an excellent question on the toxicity examination of candidate drugs. So what is your suggestion for simulation tools or techniques for systems biology, and specifically how that relates to candidate toxicity?
So our suggestion is also our experience that we used in our work related to this in silico drug screening is after one or several, or maybe if we want to screen 100 million of drug candidates, after we get a list of, say, 10 or 100 drug candidates, our suggestion would be to continue with in silico toxicity testing. And we have a very good experience with the ADME tool. This ADME tool is actually the in silico, again, tool from Swiss Institute of Bioinformatics. And then they analyze many parameters and drug likeness of the compounds that could be drug candidates, and give you advice if this drug candidate could be a good candidate, or it is better to remove it from the list of good candidates. But a better approach, of course, is to use commercial pharmaceutical tools. We have, of course, other free tools for academic use. But then if you really want to dive into these very important problems about toxicity, then you need to use proven commercial tools that pharmaceutic uses. And this was, for example, the case in our mentioned work related to the COVID, when we used commercial tool advised from our colleges from pharmaceutics to use not free tools, but really commercial proven tools that actually are used in hospitals, and etc. So we use these commercial tools. So it is actually up to you, and of course up to your target, what you need to. What is your goal and what you need to make with, for example, if you in your paper, in your work, propose that one chemical compound can be a good candidate, then you really need to make a good toxicity analysis, because you are not allowed to propose something that can have a toxic effect as a drug candidate. This is understandable, but always we have to keep in mind that this is the very first step. So in silico modeling is a very first step, and after this first step, if really some candidates appear, then of course then in vitro analysis must follow, and then after this in vitro analysis, of course, in vivo toxicity analysis, and then in vivo efficiency analysis. So it is a very, very first step, and we know, of course, that most drugs are developing, companies are developing them even 10 years or even more. So this is Vinnie, and all this in silico models are only the first step. I would say the step that can help us to eventually find some candidates in a very large virtual chemical space. Because if we deploy these models like Vinnie for drug repurposing, then I would say we have relatively easy tasks. For example, to screen out 1,000 or 10,000 already approved drugs that we know about them, about their toxicity, negative side effects, etc., etc. But if we deploy our search in virtual chemical space, like today is a normal case to screen, for example, 100 million virtual chemical compounds, then you really need to say, okay, these are these drug candidates, but then leave to other experts to eventually continue with these drug candidates. And this is, of course, what we have seen on the first slides, that with Vinnie we can do drug repurposing. That means, for example, go to DrugBank and use their structures and then analyze their drug likeness, etc. And then another step is drug discovery. Then Vinnie can go to, for example, to PubChem or to other database. It is not too difficult task to build API to any database. Of course, if this database is giving you possibility to use its APIs. And this is the second scenario. And the third scenario is to let your tool to search through virtual chemical space. And in this virtual chemical space, there are billions of chemical compounds. And then there are some other important rules that you must follow, because this is an extremely huge space, and then you need to use some rules to check if, for example, one certain drug has drug likeness or is not. And if it is, then you can say, okay, I will take this and analyze, and take another drug and analyze. Because from this virtual chemical space, very few drugs, very few virtual structures, so structures that eventually can be synthesized, will be drugs. That means chemical compounds with small toxicity, better to say acceptable toxicity, and eventually with activity against some disease. So, and this will hopefully be also our next step. Just now Vinnie has noted, but it is our plan to also build a module that will enable Vinnie to search for drug candidates in this virtual chemical space. This will be very interesting, of course, to see the results.
Yeah, no, that's fantastic. Of course, as Dr. Tomić alluded to, drug-like chemical space is quite large. I believe I've seen estimates of on the order of 10 to the power of 63 compounds. So quite large, and obviously in silico modeling, as you mentioned, it's just the beginning. So it's imperative to do follow-up work in both the in vitro and in vivo settings for any drug candidate. So there's another excellent question here, which also sort of aligns with something that I was going to ask, which is that because Vinnie requires such a large computational resources, it might not be feasible for individual research groups to actually use it just due to their infrastructure limitations. So is there anywhere where Vinnie is hosted, or any way that other individuals could use this program if they don't have access to a supercomputing cluster?
Of course. This is one of the main goals of our research, to make Vinnie available to the broader audience of either academicians or commercial entities, etc. That means to bring Vinnie from HPC clusters to commodity servers. And in this way, artificial intelligence programs based, for example, on neural networks will bring good gain to these efforts. If you can remember that it was on one slide that my colleague Josip and me deployed Vinnie on Mare Nostrum supercomputer in Barcelona to build protein scoring protein model that will allow us to compute binding energies between receptors and MAB drugs in a much more efficient way as we are doing now. Because now to compute these binding energies between these MAB drugs and monoclonal antibody drugs and receptors that we find in KEGG, we use the programs like GROMACS, NAMD, AMBER, etc. That these are very nice programs, but they are computationally hungry. So if you want to perform only one molecular dynamic simulation after computing binding energy follows, then you first you have to wait for approximately now on modern supercomputers 1 day to finish this work, and you need to have very strong computers. Of course, if you have many computing nodes, then you can spread it, and then you can, for example, for general KEGG pathway that has about 700 nodes, and if you have 700 available compute nodes, then you will have the results in 1 day. This is all. But if you are on your laptop or on your commodity server, then it will last for years before you get the results. So it is one our effort, one of the main efforts to bring Vinnie down to the as I said, commodity servers, and artificial intelligence will help us a lot. However, the main problem, while we still need to have HPC clusters and supercomputers, is that each artificial intelligent model must be learned in some way. So our approach is to use, say, classical tools like GROMACS, NAMD, and all others that there are many on the market today, to generate data and on this data to learn newly developed artificial intelligent, newly developed artificial intelligent programs. And we have already some experience, I would say a good experience. You know, the main problem what we experience, and maybe better to say challenge that we experience with several artificial intelligence programs, for example, for computing the score factor, etc., like Delta Vina, XGB Vina, Vinardo. There are many artificial intelligence programs, is that they have been learned on one data set. And here we have something, I would say, not completely that, but nearly completely new. We have cake pathways that we observed in these pathways. These are only experimental data are in them, and we observed that is a huge number of, for example, proteins that we cannot found in benchmarking data sets that mainly artificial intelligence tools are working. So, for example, we used several programs, run them under Vinnie, and observed that if we deploy them on a cake pathway, then the results are not so brilliant. So always we need to learn these tools on these data sets actually on cake pathways. Then we can expect much better results. This is and learning process is computationally very demanding. Unfortunately, no, this is.
Yeah, no, that's another excellent point. I think, as you say, training the models is a very large computational endeavor, but trained models can usually provide predictions on input data relatively quickly once they are trained. So that is definitely an exciting future development to look forward to, and also an excellent note to end on. So I'd like to once again thank Dr. Tomić for coming and for his excellent presentation. I'd like to thank all of you for your attendance and the excellent questions. Just as a quick note, we'll be sending out a survey to all of the participants here. We would appreciate your input in order to make future webinars even better. So on that note, I'd just like to end, and yeah, I hope everyone has an excellent day. Thank you very much.
Okay, thank you for the invitation and for the organization of this beautiful event. Bye.
Perfect. Bye, everyone.
Bye.